My name is Randy Bigley. Joining me on the podcast right now, we're going to talk with Josh Risch from CenterWell Home Health. Hello, Josh.
Hello there.
How are you?
I'm well.
Good.
Thanks for having me this morning.
Same here. It's your first time on with us. And CenterWell, that's a new name. I mean, you guys have been around for a while, but CenterWell Home Health is a new name, correct?
Correct. I'm glad you brought that up. We did a rebranding actually almost exactly a year ago, back in September of last year. We were formerly Kindred at Home. Mm-hmm. As a result of Humana purchasing us, we are now CenterWell Home Health.
Okay. And I remember Kindred very well. I mean,
okay.
You guys have been around for quite a while.
Yes, we've been in Marion for, I'm guessing, close to 20 years. And going off of that, I'm a physical therapist by trade, and I actually have represented the company really since it's been in the area. So
cool. What services are available at CenterWell?
We provide skilled nursing, physical therapy, occupational therapy, speech therapy. We have home health aides as well as medical social worker.
Mm-hmm. And do you guys have a website where people can get information too on
it? We do. That's a question I wasn't prepared for.
That's all right. I'm sorry that threw you off there, but you know what? Here's always tell people Google CenterWell Health.
Yes, CenterWell Home Health.
Yeah.
The office that I represent is out of Marion, which we cover the Bucyrus area. We do cut Crawford County in half to where Gallion goes to our Ontario office.
Okay, gotcha. Okay, so CenterWell is all around, right?
It is. We're actually the largest home health company in the nation, which, I'm a little leery to say that. Bigger isn't always the best, right. But I feel what's positive with that is, we're backed by a huge company that allows our clinicians to get the most up-to-date training on services. But we operate, like a small town family feel at our local offices.
So even though you guys are big, you guys are still small town local, right?
Correct, exactly, and which I think is very important.
Yeah, I mean, what are some of the advantages of being that way? What were some of the advantages of going to CenterWell Home Health?
Well, CenterWell, one thing I take pride in is the fact that all of our clinicians are our clinicians. I know there's some competitors that have to rely on, say, agency, or they contract at least like therapy out. But all of our PTs, OTs, PT assistants, OT assistants go along with that. All of our staff is ours. The only service that we do contract out is speech therapy. There's just not a huge need for speech therapy, so we can't justify having a full-time speech therapist on staff.
So that makes a big difference when you guys, it's your own people.
For sure. Yeah. We have a morning meeting every day by phone, and then as a team we meet every Thursday morning. So, that's really, it's what's best for the patient, Our communication is top-notch. We don't have to rely on a third party to give us their notes and updates. So, being a PT assistant, like I said, that's what I am at heart. I'm a clinician at heart. Yeah, I'm in this sales role. My fancy name is a home health specialist.
Sure.
But I got to be able to sleep at night if I'm going to be promoting a service in a company, and knowing the team that we have, I can.
Yeah. And I think it's important for the patient, and I know it would be for me to have the same people too.
Right.
Because
exactly.
if you have a third party, you may have somebody else that works with you, but you like to have that. When you're trying to get better and stuff, you want to make that connection with that person.
Exactly. I'm glad you brought that up. It's almost like we planned this.
Yeah.
But, and that does help with continuity care. Our patients are going to know who's going to be there next. There's no confusion there, and that's a huge benefit for our patients.
You deal with all different ages then too, or mostly older, or
Medicare age.
Okay,
now, when
gotcha.
saying that, there are some cases where a younger person might be on disability to where we can't accept their insurance. But typically it's the senior population, and it's a population that we really enjoy providing services for.
I bet so. You meet some great people, don't you?
Very rewarding.
It is.
I was not a history buff in school. I regret that.
Yeah.
But now that I'm in this field, and my coworkers as well, nothing beats meeting and sitting down with one of our patients who lived history rather than reading a book. So
pretty cool, isn't it?
It's awesome.
It is. And do you guys go into people's houses, or how's that work?
Yes, we go in their private homes. We also provide services in assisted living facilities.
Okay.
like a skilled nursing facility, just to bring up a couple names locally, like a Legacy or Ultra Care, they have their own staff. That's a skilled nursing facility. They provide all the services. But an assisted living facility, they have their own nursing staff, which brings up another point. We don't need nursing to be a part of our referral process. We can provide therapy only cases. We see that a lot in assisted living facilities because there are caregivers present.
I was just at Legacy yesterday for their open house.
I was too.
I thought I saw you out there.
Yes.
Yes, I thought you looked familiar.
Yes.
Yes. Yeah, stopped out for the new memory care unit over there. So,
Right.
Yeah. But I thought you looked familiar. Then
Yes.
I saw you
I'm
over
glad
there.
you brought that up.
Yeah. So like you said, that's just one of the places that you guys work.
Correct.
Yeah.
We get our referrals from hospitals,
Okay.
skilled nursing facilities, primary care physician offices, and just like with everything, word of mouth referrals are our favorite. We often get returning patients that we've had in the past. They enjoyed our company and they benefited from our services, and they request us the next time they need it.
That's always good to feel when they're with us.
For sure.
We want you guys back again, right?
Yes.
So if someone is needing your services or looking into it, how do they do that?
So our office phone number is 740-383-5400. And they can direct you, that's our office, they can direct you to me. And the referral process is we just need an order from your doctor. And one misconception with that is you don't need a hospital stay or a nursing home stay. The best referral is one that we identify a need early and we can prevent that hospital admission.
There's some misconceptions, isn't there, about all this?
for
And I have
sure.
to do this, and it's not true, right?
Right.
And then again, if they have any questions and they've heard something, that's you guys, right? You guys.
Correct. And another really important misconception I get frustrated in my position is when you are at the hospital or a skilled nursing facility, you have a choice, and you have to be your own voice sometimes. And when they say they're going to take care of it, I'm sure they will. But if you have the time, or maybe you have a loved one that can help you out, do the research. Go to Medicare.gov and do a home health compare, and you'll see who is best in the area, and we're one of the top ones.
That's great. Cool.
Yes.
Again, if you want more information, like I said, just Google CenterWell, which is all one word, Home Health, correct?
Correct.
All right, Josh, thank you so much for coming in here.
Thank you,
I really
Randy.
appreciate it, and we'll get people your way. How's it sound?
Great. I appreciate your time.
Nice to meet you. You too. Thank you.
Uh-huh.